Hey everybody, welcome to Pick Dr. Osborne's Brain. Got a great show for you today. We're going to be taking your questions live. So if you've got specifically nutrition questions that you'd like to ask, health questions you'd like to ask, make sure you go ahead and pipe those into your chat box or your feed, and I'll do my best to get them answered. Now, I posted something yesterday to our social media channels about stress and talking about how, when you're really doing everything well, your exercise, your sleep, you're getting regular sunlight or sunshine, you're eating well, you're drinking clean water, breathing clean air, going outside, controlling and protecting yourself from poor or bad relationships. Like, those are the things we can do every day from a stress perspective. And many of you are doing those things and still find yourself overwhelmed. And a lot of you have reached out to me through email or through or through other social media channels to inquire about the stress. And I think many of you are stressed about all the different things that are happening in the world right now. And so, again, there's stress we can control, and there's stress we can't control. And so I posted yesterday about stress, and many of you wanted me to give you my stress nutritional big guns, right? The things that, when you're doing your part, when you're controlling your diet, your exercise, etc., your sleep, and you're still overwhelmed or you still feel like you can't dig out of the hole, how can you support yourself extra nutritionally? So I wanted to give that information to you. We had such an overwhelming response yesterday, and I promised if enough of you wanted that information that I would bring it out and I would announce it today. So I'm going to go through my stress protocol. So this is what I personally use when I'm really under the gun and really stressed to the max. Regardless of trying to do everything else right, these are the things that I do or that I add to my daily supplemental regimen to help get me through those more challenging times. So we're going to start with number one. This is called Ultra Adrenal Support. And what it is it's a glandular product. What is a glandular? A glandular consists of the actual organ meats of the adrenal glands. So this product has adrenal cortex in it. It has adrenal gland tissue in it. And one of the reasons why it can be so helpful is what's in the adrenal gland of the animal is also what your adrenal glands need for support nutritionally. So there are a lot of nutritional factors within glandular products that can very much support your adrenal gland when it's being basically told to work harder than what it's comfortable doing. So I take this anytime I'm under the gun. I take 2 capsules of these. I take 2 caps twice a day, sometimes even as many as 2 caps 3 times a day. Now, this can give energy. A lot of people report that it gives energy. So if you're going to use this, you want to be cautious to take it before 4 p.m., just in case you're one of those that react to that higher level of energy. I don't want it keeping you awake because, again, we need good sleep if we're going to get through stressful times. So, again, it's called Ultra Adrenal Support. The second thing that I take lots of is vitamin B5, otherwise known as pantothenate. Its nickname is the anti-stress factor. There's actually an interesting story on how this vitamin was discovered. Famous biochemist by the name of Roger Williams was experimenting with mice, and what he found is their coats, their fur would turn gray when they had an absence of vitamin B5 in their diet. He actually named it the anti-graying factor as well. And so vitamin B5 is like go juice for your adrenal glands. And Ultra Adrenal Support has B5 in it, but you get about 500 milligrams for 4 capsules on that. You get 500 milligrams in a capsule of this. And so I take an extra 2 of these when I'm really under stress. Nobody's ever overdosed from B5. It's very safe to take at higher doses. There are actually studies showing, upwards of 5,000 milligrams a day of vitamin B5 with no untoward side effects. So you don't really have to worry about that. But this, in my opinion, is one of the major beneficial supplements to help cope with stress. Remember, your adrenal glands need vitamin B5 to produce stress hormones. And so, again, that's what you're asking your body to do when you're under that stress. Okay, the next one, and I take this every day regardless of whether I'm under stress. This is Ultra Nutrients. It's a multivitamin, multi-mineral. I like to look at it as food insurance because, Today, food is grown in topsoil that's not as nutritionally dense. A lot of the farming and agricultural practices strip away nutrients from the soil. So pound for pound, we don't get the same nutritional density of our food today that we did 30 or 50 years ago. This is the insurance plan that I like to make sure I do. So I take 4 of these a day, 2 pills twice a day with 2 of my biggest meals, and it gives me an array of vitamins and minerals. It'll support you through times of stress. It'll support you also just in your day-to-day life. The other thing that, again, is part of my day-to-day life, but especially when I'm stressed, I don't miss a dose. Like, that's something too. A lot of you may already take some supplements, and depending on how let's just say compliant you are to taking them as you're supposed to take them, some people kind of skip a day or miss a dose. That's human nature. But when you're under stress, you want to dial it in. You want to get it super tight. At least I do. Omega Max is a multi EPA DHA blend. So it's a blend of omega-3 fatty acids. The 2 most important are EPA and DHA. They help modulate and regulate inflammation. But they also help you cope and adapt with stress. You need, especially DHA, you need for your brain to be able to cope and adapt to stress. So very, very important, omega-3. Now, you can get omega-3 in your diet too. Certainly, you can get all of these nutrients in your diet. But again, we're talking about an onerous burden of stress where the level of nutrients you can get from your diet doesn't match the level of stress that you're under. So again, I take 2 of these a day, Ultra Omega or Omega Max. Now, the other big one is vitamin C. No doubt about it. Vitamin C is like rocket fuel for the adrenal glands. You need vitamin C to make cortisol, which is one of your predominant stress hormones. You also need it to properly metabolize adrenaline and noradrenaline. And so vitamin C is one of my go-tos. Now, 5 grams a day is kind of the minimum that I try to shoot for when I'm under stress. But a lot of times I find that when I'm under a lot of stress, my body tolerates more even than 5 grams. So vitamin C, in my opinion, is always taken best to your bowel tolerance, meaning that if you take too much, you'll get gas, bloating, and possibly even a little bit of loose bowels or diarrhea. That's too much, right? So you go to the level, or you go to the point where your body tolerates it without those symptoms kicking in. And again, that may range very differently. I have some people that come see me in my clinic, they're on 1,000 milligrams or 1 gram of vitamin C, and that's enough for them, right? And I have others that we got to get them to 10, 15, 20 grams a day to saturate them before they're having any kind of bowel tolerance or bowel intolerance issues. But for me, that number is somewhere around the 5 gram mark. So this is one, when under stress, this is one I also don't miss at all because it's so potent, it's so powerful. And then there are a couple of things. So sometimes with stress, people are really having a hard time sleeping well, right? And I said kind of starting this little segment that, you've got to do the 6 fundamental things you have to do every day to control the stress that you have control over. One of them is good sleep. But sometimes when we're under a ton of stress, sleep is disrupted because our mind won't allow us to relax or calm down. And so if you're in that kind of boat where your mind is racing and you're waking up at night, you're not able to get a sound night's sleep, that's going to just stress you out further. So I'm not a huge fan of sleep aids, but when the stress is heavy and I need to get the sleep, there are a couple things that I'll go to. One is something called Clear Mag. Now what this does, it's a special type of magnesium that crosses the blood-brain barrier. What I want is a lot of magnesium and getting into my brain before bedtime. Why? Because that induces a calming effect of your neurochemistry. And so what it allows you to do is have a nice, peaceful sleep. Now, if you've never tried something like this, it's important that you understand, most likely you're going to dream. If you haven't dreamt or haven't had dreams in a long time, what a lot of people report back to me is, my dreams were so vivid when I started taking this. I slept really well, but my dreams were so vivid. I sometimes call them ninja dreams because they're almost super real dreams. Like if you've ever woken up from a dream at night where you were like imagining you were running from something or you were fighting something and like it was so real, like that kind of realness, Clear Mag has the ability to induce for a lot of people. So just be aware of that. Your dreams might be so vivid in that regard that, if it's a bad dream, it may be super vivid in that way. But beyond that, it's very relaxing, very calming, and it's one of my go-tos if I can't sleep. This is actually my preference. First, I'll go to this. Now, if this isn't strong enough or this isn't doing the trick for me, I'll go to Ultra Calm. Ultra Calm is a blend of different herbals, and it's a blend of different amino acids like GABA and theanine. And what these do, if you're really under stress, the best way I can describe what it does for me is when I'm under a lot of stress, my mind is going 90 to nothing, and I feel like, for the most part, I feel like I can't focus my thoughts on what's in front of me as well as I need to be able to, because all those things are running in the background. So Ultra Calm for me feels like it almost like drops a curtain down the back of my brain where I'm capable of focusing forward. And so if you're really, really stressed and high anxiety, and you just need to feel or want to feel calmer, this is really the go-to. And this also will help you sleep. It can also prep you for sleep and kind of calm you down before bedtime. So you can take this, a couple of capsules before bedtime to see if that doesn't help you calm down and relax. I didn't mention how much of this to take on the Clear Mag, so I'm going to back up just a minute on this one. Start with one capsule, just one, about 30 minutes before bedtime. If you find that's not strong enough, you can go to 2. If you find that's not strong enough, you can go to 3. So generally 1 to 3 capsules before bedtime can really, really help induce or help with a really good night's sleep, but just be prepared to dream very, very vividly. So there you have it. Those are my nutritional big guns, if you will, for those of you coping or trying to deal with excessive stress in your life. Check those out. And hey, if they work for you, drop by, leave me a comment. Let me know what worked well for you, what didn't. That feedback is always greatly appreciated because our product line grows and we make changes based on feedback. So don't be scared to chime in and let us know how you did. Okay, let's dive into your questions. Let's see what we got here. Do ketones feed candida growth? Bonnie wants to know. Ketones feeding candida? Not really. Candida's primary metabolic pathway for energy production is carbohydrate driven. Candida are the fermenters. Candida and certain gram-negative bacteria are really majorly they're fermenters of glucose and other sugars. So ketones not so much. I wouldn't worry about ketones driving candida. As a matter of fact, a lot of times when we put people on a low fermentation or a low yeast diet, what do? We put them on a really restricted carbohydrate intake. So a lot of times people are actually going into a form of ketosis by trying to starve the yeast out of them. So I wouldn't worry about ketones in yeast. Linda says, what about using stress supplements if you suspect you have adrenal issues? I have Hashimoto's and meds still don't give me energy. Yeah, so if you have adrenal issues, this is what I recommend right here. Feed your adrenal glands with adrenal glandulars. Because again, a lot of times, this is especially true of people with thyroid disease where they're on medication for thyroid. The thyroid, and I see this all the time, people come in, they're taking either Synthroid or Armour or Tirosint or just some form of thyroid medication, and their doctors are not monitoring their thyroid levels, let's just say, effectively. And what we'll see the TSH is way too low. Like TSH typically on a lab test should range somewhere between 0.5 and about 2.5, but lab reference ranges go as high as 4.5. But what happens when you're being over-medicated with thyroid hormone is your TSH drops below 0.5. And so what that will signify is it's like you're overdosing. And if you're overdosing, it puts pressure on your adrenal glands, it puts pressure on your heart, it will make you tired, it will disrupt your sleep, it will make you anxious. And so again, if your doctor's got you on a thyroid medication, you want them to check it on the regular for you. I would say, this is my opinion, especially if you're new to it. If you're new to it, 3-month intervals to get it figured out. If you've been on it for a time, my advice is at least twice a year, ask your doctor to check your TSH, T3, T4, free T4, and reverse T3, so that you can get a good picture of what's going on and how that medicine and how that dose of that medicine is affecting you. Because again, it's very, very common for doctors to treat women, and I see this especially in women. I'm not picking on men, but I see it more true in women than men, and that they're being treated based on their symptoms, not based on their lab work from their doctors. And so what ends up happening is they end up being overdosed on thyroid hormone, and that ends up basically putting the adrenal glands in a compromised state, because now the adrenal glands can't keep up and they start to fatigue out. And so this is where, if that's the case for you, something like this is at the very least is going to support your adrenal function. But you want to go back, if you're on that medicine, you want to go back, talk to your doctor about monitoring it a little bit more tightly. I just had somebody last week, their TSH was like 0.05, which is, 0.5 is the cutoff. 0.05 is, what that means is medication dose was way too high. So send her back to her doctor to get her medication adjusted. And because she was having severe hot flashes, which was almost like mimicking menopause symptoms, right? And so she thought she was going into menopause, but she wasn't. She was having hyperthyroid induced by her overdose of her medication. When he cut it back, those symptoms started to pare back. Her anxiety started to pare back, and she got better sleep. So keep that in mind. Let's see here. Do I need to supplement if my blood work results show all my nutrients are within range? Depends on what kind of blood work you had done, Bonnie. If you had serum blood tests done, then look, this is just my opinion. Serum blood tests are highly inaccurate and don't really accurately assess what your nutritional status is. You have to look intracellularly to know your vitamin and mineral status with any great degree of accuracy. So if your doctor ran that kind of test and your nutrition looked good, fantastic. No, you don't need to go looking for more supplements to take just because, right? My advice is, if you have really good nutritional report card, two things, Ultra Nutrients, number one, and number two, Omega Max or Ultra Omega, either one, because nobody eats enough omega-3 in their diet. And the way that farming is done, animals generally don't have enough omega-3 in their tissue. And very few people eat fish, cold water fish, 2-3 times a day. It's just not a commonality in our culture. So those two things I always recommend for nutritional insurance, even if you feel good and are doing well. It's just something I recommend for prevention's sake. But beyond that, if your nutrition report card is solid, you don't, unless you just want to take certain supplements to support you in certain ways, maybe you have a family history of X, Y, or Z, and you want to support yourself a little bit more in those areas, you can do that, but it's not necessary. I mean, you don't need more reasons to try to take more pills if you feel good. Let's see. Regina asks, is this something you can take every night or only when you need it? Which one, Regina? It
was the Clear Mag.
Clear Mag. Yeah, you can take it every night. There's no danger in it. It's magnesium. The biggest side effect I see in people with magnesium, if it's not a good fit for them, is they wake up groggy, and they don't perform as mentally sharp the next day because magnesium for that person made them groggy. And if that's you, if you've ever had that happen to you, then you just reduce how much you take, because you shouldn't be waking up the next day feeling groggy unless you're overdoing it. And so different people have different thresholds, but generally anywhere from 1 to 300 milligrams, which is 1 to 3 pills of that Clear Mag, that's not enough for the average person to make them feel groggy. Every once in a while I'll get a rare bird that does get groggy at lower doses, but that's kind of the exception to the rule, not the rule. Okay, let's see here. Go up to that. Okay, here we go. Okay, so what does HLA-DQ alpha 105 gene mean without the HLA-DQ B102 gene? I'm not understanding your question. So if you have HLA-DQ alpha 105, so like 0501 or 0505, which may sound Greek to a lot of you, that means you are positive for the HLA-DQ2 marker on your alpha-1 gene. If you have an HLA-DQ beta-102 allele, that means you're positive for HLA-DQ2 on your beta-1 gene. Those two markers, HLA-DQ2 markers, and HLA-DQ 2. What's called HLA-DQ 2.5, that's if you have an HLA-DQ2 on your alpha-1 gene, are positive celiac risk predisposition markers. So if you have those, then 99% of all celiacs have those gene markers. And that's why they're positive predisposition risk. So I'm not sure if that's what you are asking me. If your doctor wants you to have both an upper and a lower GI, I can't really comment on why, because I don't know enough about you, nor would it be really appropriate for me to comment, in general. I'd say follow what your doctor's asking you to do, or at least question your doctor and get to some clarity as to why he's wanting you to do that. Because if you're struggling in your health, a lot of people, their doctors want to do upper, lower GIs as just a screening. Once they're past the age of 55, they want to do these things every 2 to 5 years, depending on your doctor. But whether or not that's something that you believe in or that you want to do, that's between you and your doctor. But if it's me, if I'm making that decision, I'm not getting a colonoscopy, upper or lower, if I'm asymptomatic, period. That's just me. Risks or not, I don't want a camera that's been shoved up, thousands of other people. I don't want that shoved up me. I don't trust it. I don't trust that the person responsible for cleaning that equipment was not having a bad day that day. That's just my opinion on the matter. And now it would be very different if you had massive amounts of blood coming out in your stool, or massive amounts of mucus or chronic diarrhea you couldn't get a control over. Now that's a different matter altogether. But for me, if I'm asymptomatic, I'm not going anywhere near a GI doctor's office where they're gonna run cameras up me that plus they're gonna put me in an environment and possibly run the risk of perforation of my intestine. And there are just too many variable factors involved in those scopes that I just wouldn't want to subject my own personal self to. Dennis says, Dr. Osborne, my dietitian advised me to drink chocolate milk instead of eating sugary snacks. Fire your dietitian. That's terrible advice. Chocolate milk is a sugary snack. Let's not lie to ourselves. Chocolate milk is, first of all, what kind of milk is it? Because if it's fat-free milk, now you're missing the fat-soluble vitamins. So one of the main points of using dairy, which would be to get fat-soluble nutrients, has now been stripped out of the product. Number two, you're putting chocolate milk in there. So chocolate, sweetened probably with some type of fructose or glucose. So again, we're talking about sugar. On its surface. Dennis, always look at the food label, right? If the food label, if sugar is anywhere on it, it's not something you should be using or consuming on a day-to-day basis. That's just my opinion. But dietitians, if you guys saw the post, maybe we can put that up for those of you who didn't see it. But I talked about the corruption in the nutrition industry several weeks ago, where we laid out, 90% of the budget for, I can't remember the name of the organization, it's I believe, the American Nutrition and Dietetic Association. 90% of their budget comes from Coca-Cola, Pepsi, and other junk food, snack food makers. So you can't, I'm not saying all dietitians are bad, because there's some fabulous dietitians out there. My mentor going through grad school was a dietitian, very brilliant man. And so again, I don't want to damn the entire profession, because but are there bad ones? Absolutely. Well, there's bad in every profession, but this particular organization is the largest membership organization of dietitians, period, in the world. Over 110,000 members, and 90% of their budget comes from junk food companies. So you can't tell me that doesn't influence decision making or their educational process. Who's writing those textbooks? Who's allowing them to tell you that chocolate milk is an okay, substitute for sugary snack, instead of telling you that chocolate milk is sugary snack? Anyway, I'll quit the rant there. What do you suggest for keeping internal hemorrhoids under better control? You got to have the right diet, Mary Ellen, because an internal hemorrhoid, a lot of times hemorrhoids are formed because the blood vessels have weak outer linings, and so the blood vessel itself will start to bulge, and that's kind of how a hemorrhoid begins to form. Those vessels are made from collagen, so you might look at supporting healthy vascular tone by taking collagen. I personally take collagen. What's something else I do every morning? I put a little bit of collagen in coffee or tea, and I drink it that way. because it doesn't add any abnormal flavor, but it gets me really, really solid forms of collagen to support, skin health and bone health and tendon, ligament, and vascular health. So that's something you might consider, but also the right diet, because if your diet's off, abnormal food sensitivities have the ability to damage the vasculature in your intestine, and that's one of the ways we can actually get hemorrhoids, is by eating foods that become irritative. So if you're having a problem with recurring, you might consider, nutritional testing to discern what foods you're reacting to. And because it's not always obvious. That's what we call a delayed hypersensitivity response, where sometimes your reaction is not acute, like the classic lip swelling or throat constriction is not how everybody reacts to food. Some people react, it just creates irritation or low-grade levels of inflammation over time. And so delayed hypersensitivity testing can be very valuable in that situation. If your doctor won't run it, go check out delayed hypersensitivity testing on Gluten Free Society. We'll put a link below for you, and you can check that out. So Kat says, I got a test. I'm not going to mention test names, but Kat's got a test back that says gluten and gliadin are definitely a no-no, but buckwheat's okay. Look, if you're gluten sensitive, which I'm not a fan of identifying gluten sensitivity using those types of tests, the inaccuracy level is high. If you've got, so this is where I default back to, if you want to know whether or not you have a gluten issue, get genetically tested, period. Don't use these other tests. They're not accurate when it comes to gluten. There are too many types of immune responses that gluten can lead to, and these tests are limited in what they're actually trying to measure. So you can get a false negative, and it's a very common thing to get a false negative. And on that particular test you're talking about, you get there's also a lot of false positives on that particular test. So all that being said, if you want to know about gluten, go get genetic testing. And then number two, if it's positive and you're thinking about buckwheat, I don't recommend it. Technically, buckwheat is not a grain, but every time we see a new research study come out on buckwheat, it's like half of the buckwheat products are cross-contaminated with enough gluten to create damage. And my experience clinically is that people that go gluten-free, that incorporate buckwheat in their diet, oftentimes have persistent inflammatory issues that will not go away until we remove buckwheat from their diet. So this is just my experience with it. So I would encourage you to, just think about that if you're using buckwheat but you are gluten sensitive. Great talk on the Immune Defense Summit. Thanks, Russ. Appreciate it. I'm glad you were able to tune in. What test should I do to assess Crohn's status? So one, talk to your GI doctor, and talk to him. A lot of them want to do a scope, which we just talked about. And so, in this situation, I'm not. This is an area where I wouldn't be opposed necessarily to a scope. But there are other tests too that can measure, large intestinal inflammation that you can ask your doctor to run. One of them is called lactoferrin. And another one's called calprotectin. So these two markers can be run. You can actually do a stool test where you can measure those markers. Lysozyme is another marker that can be measured in the stool. And these three markers are indicative for intestinal inflammation, particularly colon inflammation. So if you're trying to monitor your inflammation as you change your diet, one, it's always good to have those. Ask your GI doctor to run those as a baseline as you begin, treatment or diet change. And then over time, you monitor those tests to see, are those levels that were high, are they starting to come down as you've changed your diet and your lifestyle? And if they are, you're on the right track. And if they're not, you might be missing something, and you have to then you have to talk about digging deeper, right? And so from my experience, most of the people that I've seen do really well overcoming Crohn's have to change their diet. Three things that are the biggest triggers in my experience with Crohn's: dairy, sugar, and grain are the three big triggers. So I would, if you're not already in that direction, get there if you're trying to control that. Process of getting rid of toenail fungus. Michael wants to know. So toenail fungus is usually a sign of a deeper problem. So if you have fungus growing under your toenail, is generally, in my experience, it means your immune system is weak. It's not doing its job effectively, because toenail fungus, among other skin fungi, are opportunist types of infections, meaning there's plenty of mold all around us, fungus all around us, but when your immune system's not up to the task, those molds and fungi can attach onto your skin, grow underneath your nail beds, because your immune system's not doing its job effectively. So anytime somebody has persistent chronic toenail fungus, my first thought is this person may be immunocompromised, in which case we have to backtrack and ask, what is that? What does that mean? What is creating or what is contributing to that? A lot of times, people with recurring toenail infections or fungal infections are in mold. They have a chronic mold issue in their home. So that would be one avenue that you could explore. But oftentimes too, these people or these individuals are they're over-consuming carbohydrates. And so what happens when you over-consume carbohydrates as a whole, your blood sugar goes up, that suppresses your immune function, and you can become immunocompromised over time. We also see gluten sensitivity as a big triggering factor for mold under the toenail. So look at those things to see whether or not there's something creating immune compromisation. Vitamin and mineral deficiency can also do it. And then all those things being equal, right? None of those things being your case, how do you get rid of it? One of the best ways that I have seen to get rid of it is soaking that toenail with hydrogen peroxide. Just over the counter, go to the drugstore, hydrogen peroxide, soak that toenail twice a day in hydrogen peroxide. And that hydrogen peroxide will permeate underneath the nail bed, and it really does a number on fungus. Now, a lot of people will use a lot of the different mold applications that you can also buy in like a local drugstore. Some to varying effects, but in my opinion, hydrogen peroxide is arguably one of the best things you can use. Bags under the eyes if you get enough sleep. Leslie's asking, what can cause that? Lots of things, but allergens are a big one. So this could be environmental allergens, like if you I say mold again in the house. If you have a mold problem in your house, it's a very common cause of that. If it's allergy season for you, like if you have a ragweed allergy, or if you have like a dander type of response because you've got a pet around that you're reacting to, these are all things that could, diet being perfect, sleep being perfect, that could contribute to those bags under the eyes, despite a good night's sleep. And then food, very commonly, sugar does it to a lot of people. Like you can see it on children, interestingly enough, almost like within 30 minutes of their consumption, you can see the bags start to form under their eyes. It happens to me too. Anytime I get a hold of soy accidentally, bags under my eyes form almost immediately within about 20 minutes. My wife will look at me and say, "Where did you get soy? You just got it," because the bags start to form. And so food reactions are a very common cause of that you might want to explore as well. Let's see here. What could be some reasons for very elevated liver enzymes? ALP, alkaline phosphatase, how can you get them back to normal? Well, number one, if you've got elevated liver enzymes, ask your doctor to perform an ultrasound on your liver to rule out fatty liver disease or cirrhosis. What causes that? For a lot of people, gluten. I've seen gluten cause it. Other food allergies can cause it. Bacterial imbalance in the GI tract can cause it. There are certain types of bacteria like Pseudomonas and Klebsiella. They form compounds that damage your liver. Compounds called LPS, lipopolysaccharides. There are tests that you can have done that measure antibodies against lipopolysaccharides. You can ask your doctor about as well. And then, beyond that, the obvious alcohol, right? Alcohol definitely is a liver toxin or a liver poison. I've seen some people develop as well liver damage as a result of all of the chemicals that they're eating in their food. So dyes, preservatives, additives, processed ingredients are very, very hard or can be on the liver. MSG can be very hard on the liver. And then you have nutritional deficiencies. Two big deficiencies that can cause fatty liver. One is inositol, which is a B vitamin-like substance that helps the liver regulate fat storage. The other is choline. And we've got a really long crash course on choline you might want to check out as well. We can put that link below. But choline is a B vitamin-like substance that regulates how the liver processes fat as well. So similar to inositol, but very, very critical. And choline deficiency all by itself without any other help can actually cause fatty liver. But the number one cause I have seen for fatty liver or elevation in liver enzymes is diet. Hands down, diet, gluten being the number one thing in the diet that I see people deal with and struggle with. My doc told me a celiac test will rule out if I have a gluten intolerance. Thoughts? Depends on the celiac test they're running. If they're talking about blood tests to measure antibodies like IgG, IgA to gliadin or tissue transglutaminase or endomysial antibodies, no. Those tests can be accurate, but they can also be falsely negative because here's why. Those tests are only accurate for celiac disease. And we can make this statement, it is a very important statement. Everyone with celiac disease has gluten sensitivity. Okay, let that sink in for a minute. Everyone with celiac disease has gluten sensitivity. But not everyone with gluten sensitivity will develop celiac disease. And this is the conundrum, because if your doctor's testing you for celiac disease, they're not going to discern whether or not you have a gluten sensitivity. They're only going to discern whether or not you have the autoimmune inflammatory damage of the small intestine that can be caused by gluten. But remember, gluten can cause a lot of problems, and celiac is just one of them. There are, to date, probably close to over 100 different forms of illnesses that gluten has been linked to as either increasing, causing, exacerbating, or increasing the risk for developing, right? So for example, many people with rheumatoid arthritis actually have rheumatoid arthritis because of gluten, and they don't have celiac disease. So their gluten sensitivity manifests as joint pain. We see the same thing in people with lupus. We see the same thing in people with dermatomyositis and scleroderma. We see the same thing in people with ankylosing spondylitis and psoriatic arthritis. So these autoimmune conditions a lot of times are gluten-induced, but remember, celiac is just one type of disease. So if your doctor tests you for celiac and it's negative, it doesn't mean you're not gluten sensitive. It just means that they couldn't identify gluten-related damage in your small intestine. And remember, many of those tests will not detect villus atrophy, or rather, they won't detect damage until the damage is so severe, like the damage has been going on for a decade or 2 decades. Then I've seen cases where people had been to the doctor and had, celiac testing done multiple times, and they couldn't find it, and they couldn't find it, and they couldn't find it, and then the damage got so severe at a point in their life where they finally had a positive test, right? And this is another flaw of testing. You can go through a number of years of your life not having the information that you need to improve your health because the tests are inaccurate, and doctors don't consider that. They think that testing you for celiac is the end-all be-all, and if that test is negative, then you don't have to worry about gluten, and it's wrong. It's factually incorrect and scientifically not accurate. So that would be what I would say to that question, and hopefully you can have a good conversation with your doctor if that test comes back negative, but you feel better not eating gluten. You may want to ask for genetic testing. I can't emphasize that enough. DNA for gluten sensitivity is where it's at. All the other tests, in my opinion, you got too many flaws, too many potentials for false negative. Can vitamins aggravate internal hemorrhoids with people who have celiac? Possibly, but depends. It's one of those things where we can't make a blanket statement that vitamins are going to aggravate somebody with a hemorrhoid, but what we can say is there are certain nutrients that when given in the wrong form can be exacerbatory to an already damaged GI tract. I'll give you a perfect example. Somebody who's got a hemorrhoid flare who takes ascorbic acid. Ascorbic acid is vitamin C, acidic vitamin C, and that acid's going to increase their symptoms, not because they're reacting to the vitamin C, but because they have damage in that acid. Pouring acid on it is just exacerbatory to it. But in those cases, you could use a different kind of vitamin C that would not be exacerbating. You could use a buffered form of vitamin C. And that's one of the reasons why we buffer ours at Gluten-Free Society. Our vitamin C is actually buffered with minerals to reduce that potential for risk. That's why we see this a lot of the times. People say, I react to vitamin C. And then when we give them Detox C, they're like, this is the only vitamin C I've never reacted to. It's amazing. So, supplements can be exacerbatory, but a lot of times it's the supplement form or it's the filler in the supplement. I also see a lot of this where people buy even a product that's labeled gluten-free, and then we look at the ingredients and it's full of corn, it's full of rice flour, and these are problems too for people with celiac and gluten sensitivity. A lot of times, they're reacting to those glutens and those grains as well, which is why I don't put any of those types of ingredients in any of my products because of that kind of reaction. So, if I had a nickel for every time somebody came back to me and said, I react to this supplement, I don't want to take it. And I said, well, why don't you try it for 2 days? And if it bothers you, then we'll take it back. And then they try it and then it doesn't bother them. And the reason why is the product they were taking, again, had taboo ingredients in it or was in the wrong form. Quality matters when it comes to supplementation. Audra says, seborrheic dermatitis persisting despite animal-based diet, exercise, sleep, no coffee, no alcohol. Thanks for all the great information. So if you have persistent dermatitis, Audra, you got to get your nutrition status checked because, vitamin B1, vitamin B3, biotin can all cause seborrheic dermatitis deficiencies, I should say. But you may have a mold problem. Mold is a big one. With that situation, I see it all the time. People with chronic dermatitis that are in a moldy environment, living in mold, it won't heal. No matter what you do with your diet, you might get a blip in improvement. You might get little, let's just say you might have better days and not as many bad days, but as a whole, you still won't heal if you're in mold. Paul asked about the brain. Say that again for your brain, DSA, question mark? No, it's DHA, Brian. EPA and DHA are the two subtypes of omega-3 fatty acids. DHA is good for your brain. It's what we oftentimes refer to as brain fat. And that stands for docosahexaenoic acid. Pamela says, I had the food test and am thrilled to know what foods are bothering me besides the gluten things. If I unknowingly get some of those items, does it take as long to get it out of my system as gluten? Yeah, because it's dependent upon, part of that damage is your body's response to that food is going to generate some different types of antibodies. And so the half-life of most of these antibodies are anywhere from 30 to 60 days. So you're looking at, as long as you're generating antibodies, you're generating a compound that has the potential to create an inflammatory response. So it can take a couple months. Now, two things that you can do really easy if you do get exposure is number one, fast the following day. Fast and just give your gut a break, give it rest. Don't put it under pressure or duress. And number two is do a vitamin C flush, especially if you kind of err on the side toward more of a constipation. A lot of times what happens if you eat something you shouldn't and that food kind of stays in you, as long as it's in you, it's irritating you. So the quicker you can get it out of you, the better, right? But if your transit time is slow, what a vitamin C flush can help do is just flush that stuff out of you very quickly within a couple of hours. And so that's something that a lot of people find tremendous benefit from doing. Is oat bran okay to eat? I don't recommend it. Let's put up our oat article for Norm. Oats have a gluten in them, Norm, called avenin. And a lot of the research shows avenin creates inflammatory damage in people with gluten issues. It's just my own clinical experience that is very true. It's very hard. And I get people all the time, they come to me, they say, I've been gluten-free. They're celiac or whatever other diagnosis they were given, and they've been eating oats, gluten-free oats. And we take that away and they start healing. So oats, not something I recommend. It's just something that too often I see people reactive to. Even though they're technically being labeled gluten-free, technically they aren't gluten-free. They have avenin in them, and avenin is a form of gluten that we know can create inflammatory damage to people with gluten issues. Will be causing fever after mild workout, and what can be done about it? Well, first thing I would suggest there Well, is it a fever or is it an increased body temperature because you're working out? What's the temperature level? Like, how high does it go? You didn't put that in, so I can't comment there. But number two, actually, just talked to somebody this morning. They had mold. We actually tested them for mold poisoning, mycotoxin poisoning, and they had high levels of mycotoxin. And their house checked out. There was no problem in their home as far as the mold was concerned. But their gym that they worked out in was heavily mold contaminated. And so that was actually what was contributing to their issue, to their persistent issue. So if your gym has mold in it, that's a possibility, certainly a possibility. Mold is one of the things that we oftentimes will see will cause like a small low-grade fever spikes. And so again, if your house is mold-free but your gym isn't, you go and you work out, you get that exposure, boom, your body snaps up with the temperature to try to defend you from the toxins that you're being exposed to. Possible. Hard to say, though, for sure. Where does sleep well fit into your sleep aid list? So sleep well is, so as a supplement, it's designed more to induce sleep and get deep REM sleep, whereas Ultra Calm is designed more for somebody who struggles with higher anxiety or higher stress, because we're trying to bring that stress response down. So there are differences within the formula for that particular nuance, Diana. I think there's a part to that question. If I've been taking 2 tabs, could I try one of the Sleep Well product, or better still try the other supplements you suggest? You could do either one and see what works best for you. Is Kerrygold Irish Butter okay to eat? No. Kerrygold had a great reputation, but they're liars. They were busted. I don't know if you guys saw the expose, and it was a while back, maybe, I don't know how long ago, maybe 6 months ago. But they're no different than any other butter, mass production butter. I don't recommend Kerrygold at all, because they're liars. And they had a lot of people duped on their products. But you see the nice green picture and the cows in the nice pasture. In reality, they were just mass producing butter from cows being force fed grain, just like any other major butter producer. Are ATIs a concern in chia or flax? Not to our knowledge, Maria. Generally, chia and flax, in my experience, for people are pretty well tolerated, unless the GI tract is underperforming. So, like if you really have a lot of gut problems, chia and flax a lot of times will strain an already strained gut. But generally, if you've got a robust, healthy gut, not much of an issue. Is sourdough bread gluten-free? No, it is not. It is less gluten than regular bread, John. And let's post our sourdough article up, because actually that's a question that comes up a lot, and there are a lot of bakers saying, well, you should be able to eat sourdough even if you're gluten sensitive, because it's reduced the gluten. But it did not reduce, like when we study the quantity of gluten in sourdough preparations, what we find is it still has enough gluten. 20 parts per million is the threshold. It still has over that. So it's enough to create an inflammatory response in somebody with a gluten issue. So sourdough is not recommended if you have celiac disease or if you're majorly gluten sensitive. Intracellular, what are intracellular nutrient tests? It's where the technology that's being used is not measuring your blood levels, comparing your blood levels to other people. The technology that's being used is taking, and what we do at Gluten Free Society is we radio label the DNA inside the cell and measure the growth rate of the cell, where we provide all the nutrients to the cell so that we can get an accurate assessment of what a person's cell is capable of when it has what it needs nutritionally. And that's the baseline, right? So we get the person's unique baseline by testing their cells, by supplying adequate nutrition to those cells. Then we repeat the test in triplicate by removing one nutrient at a time from our medium, and then checking the cell to see if it continues to maintain that robust functionality. If its functionality drops when we remove a nutrient, we know that inside that cell, that person is not storing enough of that nutrient and therefore deficient. That's intracellular. It's much more accurate. It allows you to get a 6-month window into a person's nutrition status, whereas serum tests will change from day to day. If I gave you a vitamin B12 lozenge right now and checked your blood in 3 hours, I would see that your blood levels are high. And that would not mean that you don't have a vitamin B12 deficiency. It would mean I just put a bunch of B12 and it showed up in your blood when I measured it. Intracellular, you cannot trick that way. It's an average over a 6-month span of time. And so it gives us a much more accurate representation of your overall nutrition. Let's see here. Let's see, Juan says, why does my migraine leave shortly after massage on the trapezius muscle of the symptomatic side? Probably because your migraine has a musculoskeletal trigger component to it. Migraines are oftentimes triggered, they can be triggered by stress, and muscles cramp, muscle spasm, is a form of stress. And so if massage of that muscle loosens that area up and relieves you of your migraine, then you probably don't have a classic true migraine. A lot of classic true migraines are neurological in nature, and yours sounds more like a musculoskeletal issue. So you'd really want to get those traps assessed, because if you're having to go get massages on a regular basis, there could be a weakness in your traps or paraspinal muscles or rotator cuff muscles that are creating that trap problem. And so having that assessed and looked at might be a good idea to keep that migraine at bay on a more permanent basis. Allergic to fish. My diarrhea went away after I stopped my omega-3s. I have never liked dish or seafood. Can you recommend what I should eat or take to replace this? So first, I would ask Linda what kind of fish you're allergic to. A lot of omega-3s are cod, and cod allergies are not uncommon. I see it actually quite a bit clinically. You might try looking at other brands of omega-3s made from different types of fish and try different options. That would be one thing I would suggest. Because outside of that, you're really not going to get adequate omega-3. You can do plant-based omega-3, but they're technically not omega-3. Those plant-based ones like flax and chia, those are linolenic acid, which is not the same thing. Your body has to convert linolenic acid into EPA and DHA, which for many people is a very challenging conversion. Although I'm not encouraging you to eat fish, especially when you feel horrible after doing it. But if you haven't attempted to try other versions of omega-3 with different types of fish, that might also be a solution for you. The other place you can get omega-3 is in grass-fed, grass-finished beef, as well as I don't know if you have access to chickens. There's an egg shortage right now, and so but I have my own chickens, and so our chickens eat pretty much eat grass and bugs. So there's a super great amount of omega-3 in one of my chicken eggs versus say one bought in the grocery store. So if you've got access to like a farmer's market or even your own chickens, that would be another way to have a good source of omega-3 in your diet. Dion's asking if we can add, which 3 tests are you referring to, Dion? If you're talking about food sensitivity testing, I think we put a link in there for that. Gluten sensitivity testing, I think we put a link in there for that. And currently, we don't offer at Gluten-Free Society the nutrition testing. We're actually getting ready to roll that out this year, hopefully before the end of the first quarter here. So be patient on that one, and we'll come back and talk about it when it's ready. I use it in my practice, but we're trying to work out the kinks on having people be able to have direct access to it without their doctor. Can one take tests instead of colonoscopies to check for polyps and cancer? There's a new stool test that a lot of doctors are using instead of a scope called, what the heck is it called? It's the name just slipped out of my mind. Cologuard is what it's called. And it's a stool test that kind of helps to detect or pick up on some things that might indicate cancer. It's not a test that says you have or don't have cancer. It's a test that basically says if it's negative, you don't need to worry about a colonoscopy. If it's positive, you might want to go get a colonoscopy. That's what that test is. It's like a pre-screen instead of the colonoscopy. And most GI doctors nowadays are running it, so you can just ask that question. Can fatty liver be reversed? Absolutely, it can be. I've seen cases. Actually, the last case of fatty liver I saw, it was not the last one, but it's I should say the furthest along in care. This particular gentleman was given a 6-month death sentence and basically sent home to die. He had stage 4 liver failure, and they didn't want to treat it anymore. Well, he's alive, and that was, I guess, probably close to 2 years ago. And that's just how much liver cirrhosis can be reversed. Like, don't ever let anybody tell you that your body doesn't have the capacity to heal. A lot of doctors are guilty of this. Well, they'll tell you, you're going to have this, it's forever, there's nothing you can do about it. They're wrong. Keep that in mind, because it's very important that you believe you can heal if you're going to heal. Like, if you take ownership of the fact that you can never heal, then you won't. But can cirrhosis be reversed? It absolutely can be. I've seen it be reversed a number of times. You could actually go to our testimonial page in our YouTube channel, and there are, just in that alone, there's several testimonies of reversal of liver cirrhosis that you can listen to. Oh, I love this comment. So, you are my top doc. You have no idea how much you have helped. I was falling apart until I figured out gluten is at the root of my illness. Vestibular migraines, IBS, and a very long list of symptoms. That's awesome. Thank you for sharing that. I'm so glad that our message and our information is helping you. If you are familiar with the FODMAP diet, what do you think it says about staying away from garlic and onions? I think not everybody... So FODMAPs is a grouping. It's not like one diet, but FODMAPs are a cluster of foods that have difficult to digest carbohydrate-based sugars in them. Garlic and onion being part of FODMAPs, but not everybody that is. So again, it's not all FODMAP free or no FODMAPs at all. Some people react to certain kinds of FODMAPs, but not others. That's my experience with FODMAP. So I've never seen a person who had to avoid 100% of all the FODMAPs, if that makes sense. I don't know if that answers your question, but a lot of people get on the FODMAP diet and it's so restrictive, they really struggle and lose weight and have a really hard time. So, I'm not that I'm not a fan of people sometimes needing to be on a FODMAP diet, but I think sometimes people get confused because they think they need to avoid everything on the FODMAP list, and sometimes that's just not the case. Sylvia says, I have HLA-DQ 2.5, but developed Crohn's. Why not celiac first? Because again, gluten sensitivity manifests in different ways in different people. The myth of gluten sensitivity is that you have to develop celiac, or that celiac is the worst manifestation. It isn't. Celiac is one of many manifestations of gluten sensitivity. Crohn's is a manifestation of gluten sensitivity as well. Remember, B.B. Crohn, the reason it's called Crohn's is because of the doctor B.B. Crohn, who discovered after the introduction of processed cereal in the early 1900s, he started seeing massive cases of what was called regional ileitis, but was later named after B.B. Crohn because he was a pioneer that started to recognize the correlation between processed cereal and the induction of Crohn's. A lot of the problem in medicine and diagnoses is that doctors are generally, and again, I don't want to doom and damn all of the medical doctors that are out there that are trying to help people, but you just look at the culture. And this isn't just true of medicine, it's true across the board in our culture, in modern culture. Mediocrity has become the accepted way. And this is true in medicine. Like a lot of doctors that, probably, I don't know, I don't want to say this how do I say this without offending a ton of doctors? But a lot of doctors who have graduated, one, they're in the wrong place because they don't have the heart, they don't have the empathy, they don't have the bedside manner, and they're not in it for the right intentions. And so they're bad doctors, period. Just like there's good and bad in every profession, right? Now, they pass their boards and they pass their schoolwork, but that doesn't make them a great doctor, right? Anybody can memorize, anybody can be learned out of books, but it takes something special to take what you learn from books and to be able to learn how to apply that in real life situations and then develop mastery over that application over time. And the problem in today's world is, if you look at medicine as a whole, there are a lot of failures in it. And again, there's successes in it too, but there are a lot of failures. And some of those failures have to do with, more recently, the corporate buyout of hospitals, the corporate buyout of private practices. What most people don't realize is you had big corporations buying hospital systems and buying out private practices. And when that happens, the doctors that work at the hospital and work in the private practice lose a huge chunk of their autonomy, because now they've got tons of red tape and protocols that they have to follow. And if they want to deviate from those protocols, they could potentially run the risk of losing their job, even if they think it's the wrong thing to do. So doctors should have autonomy. In a one-on-one relationship with their patient, there should be no undue influence. And we now have corporate influence in the realm of hospitals and in the realm of private practice. And a lot of people don't realize that. We have another form of corporate influence in the form of insurance. When insurance industries came in and said, now your health care is going to cost you a $20 copay or a $30 copay, a lot of people thought that was a great idea. I thought it was a horrible idea, because the way it's panned out is now the value of a person's health is their copay. And that doctor, if you have great insurance, a lot of times they're going to run more tests than what they need to, because your insurance pays well. This has been proven. There have been studies that show that this is absolutely the case. But you also have the insurance industry telling the doctor what is and what is not medical necessity. And that should never be a decision that an insurance company can make. It should be a decision that the doctor can make. So doctors over the last 50 years have really moved toward a lack or a loss of autonomy in decision making. And when doctors are out of the driver's seat and are handcuffed, their capacity to help you is diminished. Their capacity to spend time with you is diminished, because the model of seeing a doctor, how many of you have been to a doctor in the last several years? You get 3 to 5 minutes with the doctor, right? You spend an hour in that office, but you might get a few minutes with the doctor. And how can anyone doctor in 3 to 5 minutes? How can they learn about who you are, what your problem is, and why your problem might be in 3 to 5 minutes? It's impossible. It's not healthcare at all. It's what can I quickly diagnose you with, get you out of here with the medicine in your hand so that your symptoms can be appeased. That's not healthcare. That's symptom management. And really, it's poor symptom management. It's very poor symptom management, because by giving you something that covers up your symptoms, what we're really doing is giving you a false sense of security that you really don't have that problem anymore. And your body is giving you symptoms because it's asking you to change something. And if you suppress those messages, then your body's going to find another way to try to alert you. That's why a lot of people end up on multiple medications, because the body's just working around the medicines, trying to figure out a way to slap you in the face to tell you to pay attention to the mistakes that you're making. But so many people have fallen into the trap of thinking that that's the solution, right? That, give me something, doc. I need you to help me. No, look in the mirror. If you want something from your doctor, the thing you should be asking for is meaningful guidance about diet and lifestyle first, because those should be primary care interventions. Drugs are not primary care interventions unless you're in an emergency room setting where somebody's got to sew you back together, in which case you want the anesthetic to put you out of pain while they sew you back together. But diet and lifestyle change should be the primary care. A lot of times they're called alternative medicine, but in reality, anybody who views those as alternative medicine, I promise you, those people are the ones that are the sickest. Those people are the ones that are overweight, that have multiple medications, that have heart disease and diabetes and other health problems. And those are just not people that anyone would look at and say, I care to emulate that person's health. Like, who do we look to? Who do we look up to in terms of, our health? Hopefully we look up to people who are healthy, who are leading a healthy lifestyle and living a healthy lifestyle and doing it every day. Because it's those people who are the real experts, right? Just because somebody has a degree doesn't make them an expert in being healthy. They may be an expert in prescribing that medication, but medication doesn't create health. Medication reduces symptoms, and those are two very different things. Okay. In the middle of healing my gut to brain axis from a for a year, yet I have 2 coin-like nummular eczema lesions upon my right inner thigh for the past 3 months, which I can't get rid of. Any suggestion? You get testing, Heidi. You need to get some specific testing done. There's a lot of things that can cause eczematic lesions on the skin. Yeast overgrowth can do it. B vitamin deficiency can do it. Other bacteria can do it. Food allergy, food sensitivity can do it. So you want to rule, if you're just following kind of like a generalized protocol, it's time to move away from a generalized protocol into a specific protocol, and for that you need to get testing. How much collagen do you recommend to fortify veins? 10 to 20 grams a day, depending on how your bowel tolerates it. So I generally do about 10 a day. If I go over that, collagen is very rich in certain amino acids that can cause loose bowels. So, sometimes collagen, you take what you're capable of tolerating, but don't go over that. Which omega-3 is best for celiacs or for Celtics? If you mean celiacs, and that's just a typo, this one's my favorite here. Omega Max. And if you have pancreatic problems, we have another blend called Ultra Omega, which is designed for people who have a history of fat malabsorption problems. So if you're missing your gallbladder or have pancreatic problems, then Ultra Omega is a good option because it comes with the enzymes that help you break it down and degrade it. Mast cell disorder, believe it came after celiac. Any hope of healing following a correct gluten diet? Yeah, a lot of people with mast issues find tremendous benefit by going gluten grain-free. So I definitely would start with that first. Sarah, you might check out my book, No Grain, No Pain, because there's some other specifics, again, generalized specifics in the book as far as diet change that you might also find beneficial on your journey. What vitamins or minerals should we never mix, or at what time we should never take it? I mean, the biggest thing is if you're on medications and you're taking a particular vitamin that might interact with your medicine, if you're talking about pure vitamins and minerals, because vitamins and minerals are relatively safe, you can mix them together and there's not much of an issue at all. Now, where you can run into a problem is if you're using a bunch of different types of herbal products that might have interactions. And so there are books written on drug herbal nutrient interactions. There's no way I can disclose texts of information in this short blog. Does having dermatitis or pediformis automatically mean you have celiac disease if you're gluten intolerant? Yes, it does. DH is a manifestation of gluten, for sure, 100%. So guys, quit it. There's so many people that try to do the workaround with grain. If oat fiber is certified as gluten-free, is it safe for use? No, it's oats. Get it out. You want to heal? Get out grain. Get them out. Quit asking me roundabout ways about how you can still have grain even though it's labeled gluten-free. The answer is always going to be no. Oat grass, barley grass, wheat grass, oat bran. If it's a grain, and a grain-based item, you want it out. If you want to heal, you've got to get it out. That's my experience, and that's my advice. So I like this one. You've helped our family tremendously. We are grain-free. Love it. And your book has helped. We would be completely lost otherwise. Thank you. That's fantastic. I love hearing those kinds of stories. Can we give 5-year-olds omegas or something else for lack of concentration in school? Yeah, absolutely. 5-year-olds need omegas too. Omega-3s are essential fatty acids. That means the body can't function without them. So yeah, 5-year-old, I'd probably give a gram of omega-3 in that situation, a full gram, a mixture of EPA, DHA. Like 1 gram would be equivalent to like 1 pill of Omega Max if they can't swallow. We have a kid's chewable version as well called Omega Kids that you can give. Let's see. You said a few weeks ago that cherry angiomas can be a sign of high estrogen, and having it checked, I think I may, where'd it go? Okay, long question here. So yeah, cherry angiomas can be a sign of high estrogen. Where we see women develop them overnight for no reason. You're actually, because Jessica, you're mentioning high ochratoxin A. You got a mold problem. There's another mold toxin called zearalenone that mimics estrogen, and it can cause a lot of cherry angiomas to form on the skin. When I was in mold, they were popping up on my body all over the place. And I was an emotional mess when I was in mold. So that if you've got high ochratoxin A, and it's possible you're in environmental mold, and that you're also getting exposure to zearalenone, which is the toxin produced by the mold fusarium. And if that's the case, no matter what you do with your blood or your saliva or any other way that you check your estrogen and progesterone, you're not going to get to the root. So again, because you have that high ochratoxin A, I strongly suggest you hire a mold company to come out and investigate your home and make sure that you're not living in a mold, in a mold contaminated environment. Trigeminal nerve pain. Leah wants to know, do you have any suggestions for trigeminal nerve pain? Yeah, go gluten-free. That's the first one if you're not already. I've seen countless cases of trigeminal neuralgia go away just by going gluten-free. Remember, gluten's a neurotoxin, and one of the ways it can manifest is through nerve pain, and trigeminal nerve pain as well. Thoughts on kefir? Not a fan if it's a dairy kefir and you're new to the gluten-free diet. Generally, we recommend people avoid dairy at the very least for the first 6 months because of the crossover reactivity that it shares with gluten. So let's say you've been gluten-free grain-free for a really long time and you're feeling fantastic and you want to try to add some dairy back into your diet. There are rules around dairy. We can put up an article below on the dairy rules that you really want to be aware of. It's pretty long list of things. The biggest thing is that dairy should always be A2, and if you don't know what that means, again, we'll put that article in there and you can go read it. Can you alleviate varicose veins naturally? Sometimes yes and sometimes no. Depends on the length of time they've been there and depends on the overall health status of the individual in my experience, but I have seen cases where varicosity started to diminish or go away, especially when you catch them early enough. Sylvana asks, I was curious to hear your take on this. Is the methyl group of the activated B12 methylcobalamin cut off in the digestion process? And is this why we should take? I don't understand your question. No, the methyl group is not cut off in the digestion process, but even furthermore, if you're taking something like mine, which is methylcobalamin, is a lozenge, it's absorbed through the cheeks and it goes into the bloodstream through the buccal mucosa. So we bypass the digestive tract. So even if there were some cleavage of methyl, slight cleavage in the digestive tract, you would bypass that by going oral lozenge route instead. That's part of the reason why we have it in a lozenge form. Janet says, what brand of collagen do you recommend? We have something, Janet, called Ultra Collagen that is certified gluten-free and definitely something that, if you have a gluten issue, you can use that and feel real safe about it. Is sprouted bread like Ezekiel gluten-free? No, it's not gluten-free at all. Sprouted does not remove gluten. Good butter replacement. Depends on where you live. You can look online. There are a few A2 butters out there that you can get online. So I would just look up A2 grass-fed butter and then do your homework. Let's go down a little bit. Okay.
Yeah, I just posted
those. Let's see here. No, not a question, that's a comment. I'm allergic to nickel. How can I get rid of it? Recovering from open heart surgery, problems with food because all foods have nickel. you know, I would doubt your diagnosis of nickel allergy. Not to say that you're not, but there's nuance to that I probably can't answer in this type of setting. But you know, if you're trying to pull metal from your body, we have something called, Mary, we have something called ultra metal detox. And it's a mixture of cysteine and garlic and cilantro and other heavy chelating agents, natural chelating agents that can bind metal and help your body from storing them. But that would be one place that you could start. It's just doing that to try to be as preventative as possible. But again, nickel allergy, like I said, get with your doctor, because there's some nuance to that, and that might not be a fully accurate assumption that you actually have that. Is iron better absorbed on an empty stomach or with food? With food. Iron is one of those, it's best absorbed when you have acid. So if you put food on your stomach and your stomach starts producing acid, iron is going to be better absorbed when there's acid production. Iron on an empty stomach can also cause nausea, a lot of nausea for people. So just be careful of that. Can a root canal or tooth filling weaken one's immune system? Depends on the filling. You know, nowadays, most dentists are using amalgams that are not silver, so they don't contain the mercury. And that's a good thing, because that's one thing that could weaken the immune system. As far as a root canal is concerned, it depends. I mean, all root canal is, you're killing your tooth, so you're leaving a dead tooth in your mouth, and a dead tooth is a hotbed for infection, which can overwhelm the immune system as well. So yeah, that's I would get with a good environmental dentist and have a cone beam X-ray done where you can make sure that root canal doesn't have an infection in it. Let's see, follow up on trigeminal neuralgia. Thinking possible nutrient deficiencies that you may have experience with B12, B6 maybe. Oh, for neuralgia, it could be. I mean, B1, B12 is common. Folate is a common cause of neuropathy. B6 can be a cause of neuropathy. I'm talking about deficiencies. Biotin can be a cause of neuropathy as well. So I mean, really any of the B vitamins are possible. Alpha lipoic acid could be another issue there, or you could also there could be something else completely even away from nutrients. If you're grain free for several years and still dealing with trigeminal neuralgia, there may be another trigger in your food or in your diet beyond gluten that you want to explore. And that's where I would suggest you look at food testing, possibly also look at other potentials for environmental chemical exposures that might be neurologically damaging. So things like mercury, lead, cadmium, all those things can damage the nerves as well. So have your doctor check into those things, Leah. All right, I think we're already 20 minutes over time. So, okay. I think I got most of those questions answered. Thanks so much for tuning in. Again, don't forget, hit the like button, hit the subscribe if you want to get notices when our videos go live, and share this stuff. Look, we've been censored now for the past 3 years. You guys know why. So the only way we're really making a dent to our mission, which is to save 100 million lives, is through your generosity and your desire to help me help more people, get better, right? So share this information with the people that you love most, and become the shining beacon of health that they need to see in their lives, so that they can have an example to follow, so that they even know the right journey to take. Because so many people are so confused and so lost, and have so much faith and trust in all the wrong things. And so you can become that person to them, and we can help. Together, we can save 100 million lives. So beyond that, come visit me at glutenfreesociety.org. Make sure you sign up for our newsletter there. I'll send you a bunch of free information on how to do the gluten-free diet right. And we'll see you next Tuesday evening for another show of the Dr. Osborne Zone. Take care.